Jenny Brayton, and I'm here to do a little casual, informal peer counseling session about cocaine, a subject that I know quite a bit about, actually. Cocaine is really prevalent in Seattle, especially. I know a lot of people that have done it. I've worked in the restaurant industry for over 20 years, and I've known people that sold it and people that used it all the time, and unfortunately, to my chagrin, I became one of those people as well. Cocaine is a really strong stimulant. In the USA, it is classified as a Class 2 drug. This means that there's a high potential for addiction, although it does have a few accepted medical uses. Cocaine is used by healthcare professionals to temporarily numb the mouth, nose, and throat for minor nasopharyngeal procedures. This means that they use it as an anesthetic and also a vasoconstrictor. This means that it causes the blood vessels to narrow and an effect that decreases bleeding and swelling from the procedure. The physician will apply cocaine directly in a topical solution, directly on the tissues of the nose and mouth. The vast majority of cocaine is used recreationally, however. Cocaine produces intense feelings of euphoria, happiness, and sometimes paranoia in the user. Is commonly used as a party drug. In the US, is the second most commonly used drug for recreational use behind marijuana, and even more frequently than heroin and amphetamines, although their use is becoming much more prevalent. Snorting cocaine can cause severe nasal problems. It causes blood vessels in the nose to constrict, cutting off oxygen flow to the nasal tissues. Other chemicals that dealers add to cocaine, such as baby laxatives, sugar, baking soda, and other things, can also irritate the lining of the nose. Inhaling cocaine can lead to infections of the nasal and oral cavities. When people snort coke for a long time, the nasal cavities can collapse. Holes form in the septum of the nose, which is the dividing line between the two sides of the nasal passageways. Other parts of the face can also be damaged. About 5% of people who snort cocaine will develop a hole in their nasal septum. This is something that happened to me as well. I have a very small hole in my nasal septum, but it's there permanently. It's kind of annoying, but it's not something that I'll probably ever get surgery on. But it has left me with a permanent whistling nose. So it's not something that I'm proud of, but it's there. So some people take cocaine orally by rubbing it on their gums or mixing it into a drink. Others wrap it in tissue or toilet paper and swallow it. This is called parachuting or bombing. This can lead to severe bowel decay. There are many oral implications of cocaine use. One of them is dental caries. Cocaine users experience an increased rate of tooth decay for a variety of reasons. The drug contributes to xerostomia, which is also called dry mouth. The user does not seek regular professional care or perform regular personal oral care. They may rub the drug directly onto the gingival tissue, resulting in tooth erosion. It also may cause bruxism and TMJ, that's clenching and grinding of the jaw, and is very common for all stimulants. But cocaine and amphetamines are probably the worst for that. It can also lead to gingival and periodontal disease. Xerostomia and lack of routine oral hygiene may lead to an increased rate of periodontal diseases. Bruxing may also contribute to disease. That's because it wears away the enamel, and it also tires out your jaw, so it makes you more susceptible to infections. The user may also rub the drug on their gums, and this can result in gingival lesions. Regularly snorting cocaine can lead to loss of sense of smell, nosebleeds, problems with swallowing, hoarseness, and an overall irritation of the nasal septum, which could result in chronically inflamed runny nose. Other manifestations include oral candida infections, perforation of the palate. This means that a hole will develop in the palate between the nasal cavities and the oral cavity. There will actually be a hole in the hard palate of the user. halitosis, glossodynia, erosive licoid planus, corrosion of gold restorations, and excessive hemorrhage after tooth extraction. Cocaine users may exhibit buccolingual dyskinesia, a movement disorder characterized by protruding the tongue and pursing the mouth or lips, also known as crack dancing or boca torcida, which means twisted mouth. I have to say that I never experienced all of these things to the degree that's described in what I researched, but I definitely experienced a lack of interest in oral hygiene when I was using. All I cared about was using and then getting beer. And I did it like it was my job. It's not something that I'm proud of, but it's something that I learned from. And now I feel that I'm here to share my experience, strength, and hope with other people that may be going through some of the same things. It was a painful experience. It cost me a lot of money, cost me some of the years of my life. But I'm glad I came out on the other side, and I'm glad that I don't use Coke anymore. I haven't for 5.5 years, and that's something that I'm very proud of. Thank you for listening to my presentation.